Patient care navigators have been around in various forms also since about the 70s or 80s, and mostly in cancer care, and originally started in cancer care, in fact, by a doctor in New York who was treating a small sample of poor Black breast cancer patients in Harlem. And the idea was, these women aren't getting the treatment, aren't accessing the system fully, and so he created this position of a patient care navigator. So results showed that the women who had access to this assistance had lower mortality rates, they had a better experience. So we now in Canada have healthcare navigators very much entrenched in the cancer care system, but also in other illnesses, HIV to a certain extent, Parkinson's, there's some, dementia and Alzheimer's, not so much yet, but we're getting there because those people who work as navigators are of course familiar with patients who have dementia, but it's not the dementia that is bringing them to the navigator first. So in my story, we have patient care navigators in the public system here, so through your hospital or through your doctor, but also through a private system that you can pay to have someone work for you as a patient care navigator. And so in the course of working and writing health stories for alzlive.com, I was looking at those navigators in the private system as well as in the public system. And so both fill the same role, but in the private system, you can get service faster. You can get service more intensely, meaning daily connection, daily check-ins, weekly phone calls if that's what you want, because you're paying out of pocket for them. In the public system, usually your introduction to a patient care navigator starts with being admitted to hospital, but not necessarily for an emergency. If you were at a hospital memory clinic, they may connect you with the hospital's patient care navigator. And one of the things about patient care navigators is, often you have to ask for these things. So if you are in hospital, or your mom is in hospital, or some loved one is there, you're not necessarily going to have a knock at the door saying, "Good morning, I'm the patient care navigator, how can I help you?" And one of the things that I've learned is you need to ask when you're at a hospital or when you're at a clinic, do you have patient care navigators? Do you have a geriatric nurse on call? Do you have a palliative care team? You have to know all of these titles and services so that then you can put your hand up and say, does your hospital happen to have one? And I think a patient care navigator is something that is fairly immediate and easy to access, and you're not usually going to have to prove too much need in order to get their services. And they fill out paperwork, they make phone calls, they can explain to you your chart. Sometimes it's difficult to read a doctor's chart, and for those of us who are lay people, this is their role. And everybody should ask if there's one available.